Been crying for a while. He's the one who usually helps me with hard things like this, she said, with her gaze still fixed on the past. I miss being able to talk to him. I feel like I'm the one dying. Finally, she looked at me, her expression weary and pleading. I wish God would just tell me what to do. In the right circumstances, modern critical care saves lives. The moments when I have lifted my most raw and heartfelt praise to the Lord have occurred within the walls of the intensive care unit, when I have witnessed His grace and mercy made manifest in the recovery of a child battling a widespread infection, a man fighting for his life after a motorcycle crash, or a woman whose heart strains in the throes of a heart attack. Yet medical technology harbors a dark side. When an illness cannot be cured, aggressive interventions prolong dying, incur suffering, and rob us of our ability to speak with loved ones and with God in our final days. Ventilators steal both voice and consciousness. Resuscitation looks a lot like assault. In the ICU, we often awake in panic and find ourselves physically strapped to a foreign bed, deprived of the familiarity and comfort of home. We clamor for air, only to find we have no freedom and no voice. When our critically ill loved ones cannot speak to us, we wrestle with impossible decisions of whether to press on or to withhold treatment, all while we yearn to hear a beloved voice again. Like the wife holding my dying patient's hand, such dilemmas thrust us into grief, doubt, fear, anger, and even guilt, as we struggle to reconcile a web of hospital instruments with a mother's voice, a father's laughter, or a child's smile. While we wrestle, concerns about faith also haunt us. Death is a profoundly spiritual event that rips us from the people we most cherish and pitches us into doubt about suffering, mercy, and the God whom we serve. What is God's will, we ask? Why is God allowing my loved one to suffer? What does the Bible allow in this scenario? Such questions tap into our deepest anguish, a pain that echoes from our origins as image bearers torn from God. Death is the wages of our fallenness and the final enemy. Romans chapter 6, verse 23, 1 Corinthians chapter 15, verse 26. Even Christ wept in the face of death. John chapter 11, verse 35. Yet when they deliver devastating news, too often physicians, and I include myself among the culpable, ignore these concerns and suggest chaplaincy services as a conciliatory afterthought. We focus solely on monitors and machines, and in so doing, we transform death from a process directed heavenward to one steeped in nomenclature and obscurity. Percentages soothe little when we pine for hope. Medical terms offer no solace when the soul thirsts for God. Psalm 42, verses 1 through 2. When it so heaps decisions of life and death upon us without a grounding in faith and Scripture, medicine casts us adrift, rudderless. We stumble forward under duress, without understanding how the lines, tubes, and numbers equate with the truth that death has been swallowed up in victory through Christ. 1 Corinthians chapter 15, verse 54. The idea for this book arose in my heart during my 10 years caring for patients in the intensive care unit, ICU. First, during my surgical and critical care training, and then as a trauma surgeon who worked extensively in the surgical ICU. Over the course of that decade, I had the privilege of partnering with people during their most vulnerable moments, and I loathed the disconnect between the technical details that I laid out and the pain tearing them apart. As I would lean forward in my white coat to inquire about resuscitation and feeding tubes, the weight of unvoiced questions bore down upon us. Questions of God's authority, of His goodness, of sanctity of life, and of suffering. These questions sprang from concerns fundamental to our Christian faith, but they hid beneath the trappings and decorum of a secular medical system. To honor God in the bleak setting of the ICU, We must clarify the expanse.